Good morning, good afternoon, good evening, depending on where you're signing in from. My name is Nana Ndukwe-Hetch. I'm the global lead for the UN Workplace Mental Health and Wellbeing Strategy, and it's a real pleasure to see so many participants signed in today for this World Mental Health Day event. So this event is a collaboration by many stakeholders. We have some distinguished speakers who will be part of the panel a lot later on. Just to remind you, the Global Mental Health team are all going to be present today to support in ensuring that this event goes according to plan. We have my colleague Chung, who will be in charge of the timekeeping, and Lucia Vinti, our program coordinator, will be monitoring the chat for any interventions. And Marie will also be in charge of supporting the technology. I will give you more of an overview later, but first of all, I just wanted to hand over to Maurice to provide a quick video before we start. Over to you, Marie. So you're all familiar with this year's theme on access to services, mental health and wellbeing in the context of crises and catastrophes. So this year's World Mental Health Day 2025 really highlights the importance of ensuring equitable access to mental health services in times of emergencies and catastrophes. As you know, natural disasters, conflicts, pandemics, and other crises not only disrupt essential services, but also they intensify risk to psychosocial well-being. Within the UN system, it's really critical for us to strengthen awareness of the support that's available to personnel and to share best practices on providing effective, timely, and coordinated mental health care in high stress contexts. So this webinar roundtable today will bring together experts and practitioners from across the UN system to raise awareness about access to mental health support during emergencies. We aim to destigmatize seeking support for mental health concerns, whether informal, such as through peer support networks, or through formal professional mental health support. We also would like to highlight UN initiatives, the available tools and approaches to supporting staff and dependents in crisis situations. And the final aim is also to try and foster dialogue on strengthening resilience and coordination in emergency psychosocial responses. So given the context of this year's mental health theme, before we begin, I also just wanted to offer a content warning. The discussion will include pictures and also references to distressing events such as recent global conflict, natural disasters, and pandemics. And some participants might find parts of the discussion emotionally triggering. So just be aware of that. And as always, take care of your well-being throughout the session. So of course, if you need to step away, that's totally fine. Pause your participation at any time if needed and access the available support through your organization. And our goal, of course, as always, is to create a safe, supportive and respectful space for learning and dialogue. So just to kick off this event, we have three distinguished speakers. And what I aim to do is to start by introducing each of them before I pose questions to them. So we're really looking forward to learning from each of these three speakers. The first speaker for today is Mohammed Suhail Ali, who is the chief of the Critical Incident Stress Management section, who many of you are well aware of. So Suhail, based on recent data and field observations, what trends are emerging in terms of the experiences that humanitarian personnel operating in crisis context And with that in mind, what are the most pressing challenges in coordinating psychosocial support across UN entities during emergencies to ensure that staff and dependents are effectively supported? So a bit of a loaded question, but just to get started, we would be interested to hear your observations around that. So over to you, the floor is yours.
Thank you, Nana. I hope you can hear me.
We can.
Okay. Thank you, colleagues, for joining today and giving me the opportunity to speak. It's a privilege. And Nana, related to your question, it's very important. There are two elements to that question. What are the current global trends? And then what are the challenges in coordinating a system-wide approach and some key initiatives related to that? So in terms of the global trends, I'll quickly focus on the physical trends and the psychological impact of those trends. In terms of physical trends, over the last 5 years, from 2020 to 2025, there's been a very worrying change in the trend on impact on humanitarian workers and their families during emergencies. There was a time when humanitarian work was considered protected, and humanitarian workers were protected because of their work. Now, unfortunately, in some emergencies, they are impacted despite their humanitarian work and sometimes because of their humanitarian work. Over the last 5 years, the number of humanitarian workers killed per year in emergencies has increased by 300%. So 117 aid workers were killed according to open source information in 2020, and 385 globally were killed in 2024, again, based on open source information. And the number of humanitarian workers injured has also tripled in the last 5 years. And around 125 aid workers globally, they are either kidnapped or taken hostage from all over the humanitarian sector per year. So those worrying trends in terms of injuries, kidnappings, intimidation, threats, and the deaths of humanitarian workers, if you look at the psychological impact, it runs in parallel to that and sometimes much more exacerbated, because each humanitarian worker that is killed has a family. And the family then, the children, the spouse, the elderly, they are impacted when their loved one who went out for humanitarian assistance or peace building work does not come back. So in terms of the psychological impact, there's been a mushrooming of grief and anger among families. And what we have seen globally in 20 emergencies, we've studied about 10,000 humanitarian workers in 20 emergencies across the world. 1 in 2 humanitarian workers are exhibiting signs of post-traumatic stress, and 1 in 4 humanitarian workers are exhibiting signs of burnout. And after the emergency, 1 in 5 are at risk of developing long-term mental health consequences. And that impact is quite long-term, it's severe, and it's exacerbated by the impact of social media and the proliferation of violence, the element of disillusionment with the humanitarian sector that sometimes emergencies give rise to, complex trauma where grief and anger is mixed with trauma, and the concept of moral injury where humanitarian workers are often prohibited from doing what they have been recruited to do because of the situation on the ground. So those elements of moral injury, vicarious trauma, complex trauma, that is exacerbating the psychological impact even further. To give you an idea, there are 180,000 humanitarian workers globally working for the UN system. So this is the impact at the moment for them. These are the main trends. Now, in terms of the challenges in coordinating a United Nations, system-wide preparation and response to emergency management for psychosocial support, there's much to say, but I'll highlight 3 key challenges. One is the disproportionate impact on locally recruited personnel. Our data has shown us that locally recruited personnel are 22 times more likely than international personnel to be injured or killed because they form the majority of our workforce, sometimes 80% of our workforce. So even though they are multiple times more at risk, the media attention is 500 times higher when it's an international humanitarian worker as compared to locally recruited personnel who bear the brunt of what is going on. So there is that disproportionate need. That's one challenge. The other challenge is about ensuring equity of care. Like I mentioned, there are about 180,000 humanitarian workers globally working in over 50 different UN organizations. And different organizations have different capacity. So ensuring equity of care, that every humanitarian worker, regardless of which UN agency they're working for, have the minimum required level of psychosocial support. That's the second challenge. The third challenge is the decreasing resources that are now available for humanitarian operations, and within humanitarian operations that are available for psychosocial well-being of humanitarian workers. So globally, there's been over a 20 to 40% cut in resources. So those three challenges, ensuring equity of care, regardless of which UN agency you're working with, ensuring a proportionate support for locally recruited personnel, and ensuring that the resources are optimized. So there are three key things that I can share with you that are happening at this side. In terms of optimizing resources, there is a renewed and energized effort to improve coordination and collaboration across the UN system for emergency preparedness. So DSS heads the Critical Incident Stress Working Group, which has mental health teams and counseling teams from all the UN system. And through the regional cells for each geographical region, we try to ensure that we can leverage the capacity of each of our partners and meet gaps and optimize the resources that we have on the ground. So that effort has become key in this resource scarce environment. The other initiative that we are trying is there's an effort going on for many years, but now more energized, to train local mental health professionals in a country so that one, they have more capacity for mental health crisis management in the host country, plus they can support the UN as well. So there is a DSS certification program for mental health professionals to equip them to support humanitarian workers where we don't have internal capacity. And the third effort that is being made to ensure that we are able to address the gap on for locally recruited personnel is to hire more local mental health professionals as stress counselors and staff counselors because they're familiar with the culture, they're familiar with the language, they're familiar with the context. So they're able to support their colleagues in a better way. So those three initiatives of training mental health professionals from the host country, that has helped with increasing outreach, increasing coordination between the UN system to ensure optimized use of resources and minimize duplication, and ensuring that there is cultural sensitivity and linguistic sensitivity to meet people where they are, and especially the locally recruited personnel. So I'll stop there and I'll be happy to contribute for other questions. Thank you.
Thank you very much, Suhail, for giving us such a comprehensive overview of the burden that humanitarian personnel are faced and a lot of the themes around coordination and support. There will be opportunities to, of course, expand on some of those points later. I will be moving on to our next speaker, but I also just wanted to remind participants that you may pose your interventions, questions within the Q&A function. Thank you. Our next speaker is Ash Kais, a PhD. She is a licensed psychologist from the United States with over 15 years of experience in mental health settings. She currently works as a staff counselor in the World Food Programme's HQ in Rome, Italy. She has several years of experience working in emergency humanitarian situations, including with WFP in Sudan, the UN in Mali, and with an NGO in Calais, France. She values voice, authenticity, and storytelling as forms of empowerment and healing after difficult experiences. So Ash, you're more than welcome to the panel. And my question to you is turning to your experience in Sudan. Could you share with us what it was like on the ground as a staff counsellor, and how has that experience shaped you in terms of your practice? Over.
Thank you so much for asking me to share my on-the-ground perspective in Sudan. And I'll mostly focus on my time there during the war, even though I was there for over 3 years. And it was validating to hear Sohail speak about trauma, because that will be a bit of a thread in my story. And before I begin, one of the keys to healing trauma is being able to have a remembrance and a narrative of one's own experiences. So that's not necessarily what's on the news. It's not somebody else's story of what happened, but your own unique story and meaning for what happened for you. So I'd like to note that I have told my story privately within a therapy setting and with loved ones, and this is a really challenging subject for me to speak about, but it's equally very empowering. So thank you for listening. And I'd like to be clear that this is just one unique story. Sohail, I was so glad to hear you bring up national employees. I am an international employee. So my story is just one of many, many, many stories. And quite frankly, there are many terrible stories from other people who experienced those early days of the Sudan war and who are still experiencing the war in Sudan. So please, my story shouldn't be compared or generalized to other people. So April 15th, 2023, that's a date that I will never forget for the rest of my life. I woke up one morning hearing explosions and gunfire, which at first my brain couldn't even compute. I thought maybe it was a thunderstorm, but it wasn't rainy season. And when I looked out my window, I saw explosions, fighter jets, trucks zooming through the streets, firefights. The airport was on fire and exploded a number of times. There was huge plumes of black smoke coming from the airport. Within a day, my specific neighborhood was completely saturated with soldiers taking over homes in that neighborhood. And for the next several days, I was trapped in my apartment and having to be on the mattress in my kitchen, because that was the only place with no windows and was considered the safest place. I was rationing my food and water. I remember even putting a little line with a black Sharpie marker on the water jug to try to monitor how much water I was drinking each day. The electricity was cut, so there was no running water, and it was extremely hot inside. And little by little, my devices were running out of power. My phone battery was dying, laptop battery was dying. Miraculously, the comms were not cut during that time. We still had internet. And during that time, I was also still in the role of staff counselor. And while I was going through my own difficult experience, I really welcomed when employees reached out for counseling support, because it distracted me and it made me feel like I had a really important purpose in all of the chaos. And there was a lot going on. On that day, actually, 3 of our colleagues tragically died in Kap Kabia in Darfur. Unfortunately, they were caught in the fighting between 2 armies. Osman, Sadiq, and Yusuf May they rest in peace and rest in power. We had an employee shot and interrogated. We had employees physically assaulted, thrown on the ground as they were trying to seek safety. Employees were being shot at in their cars as they were trying to escape to safety. People being forcibly and violently removed from their homes. Employees trapped in safe rooms within their offices. People were stuck in areas where there was very heavy fighting with limited access to escape or resources like water. And there were rumors of rape being used as a tool of warfare, which we now know is true. And one of the worst parts of my experience was when I had to flee my home after those several days of being trapped. It happened so suddenly and was unplanned, and I ran out of the apartment building. It was the first time I was out of the building in those several days, and there was a line of soldiers holding their semi-automatic weapons, maybe just a few yards away, maybe a dozen. They watched us scramble as we figured out which cars we were going into, how we were going to try to leave, and it was a really risky moment. And we were several people packed into a car plus one cat. And we went through these checkpoints, which felt like a lifetime. We didn't know, it was every block, these checkpoints, and you didn't know if they knew that you were with the UN, or it was very chaotic. And in just maybe 6 blocks outside of my neighborhood, there was no military presence, and I even saw a couple people picking up supplies at a shop. And I was completely shocked. I thought all of Khartoum had been what I had just seen and witnessed for the last several days. So needless to say, those several days were really shocking and quite a terrifying time. And there were definitely moments when I thought somebody was going to break in through my apartment door and assault me, rape me, kidnap me, kill me. I didn't know. And you were hearing so many other things, so many other stories. Eventually, we did make it to a hotel, which wasn't even safe. There were stray bullets all the time coming through windows, and we had to take shelter in the basement. And a couple days later, around 1,000 UN and NGO workers and family members, mostly internationals, evacuated by road. National employees were had the choice to self-evacuate, unfortunately. We were around 75 vehicles and coach buses traveling 36 hours through the night to Port Sudan. And once there, a couple days later, hundreds of us boarded a French Navy ship, and we sailed to Jeddah, Saudi Arabia, where we were then flown to Nairobi. And there's this photo of me on the Kenyan State Department of Foreign Affairs Twitter, and it makes me think of what Sohail was speaking about news coverage. But it was, when I looked back at that photo, I had a big smile on my face coming off of the plane, which I think was just relief, but also shock. And I had just my messenger bag with a change of clothes, my laptop, some important documents, and because I lost all my belongings. Thank goodness I had my life and my health, but I lost all my belongings. And I also had a plastic garbage bag with half-empty bottles of water and biscuits that I refused to let go of because I didn't know what I would be eating or drinking next. And so as a staff counselor during those early days of the war, I think many people didn't necessarily need or want immediate counseling. Some people did, of course, but really, I think a lot of my role was providing a positive presence and striving to keep up morale and keep hope and making sure that mental health was acknowledged with leaders in some of the decisions they were making. And I also did quite a few informal check-ins with people just to make sure they knew someone cared about them and someone was checking in on their emotional well-being. And then Nana, you asked me the question, how has this experience shaped you? And in many, many ways. And also I worked for about 5 years in really difficult duty stations. So I'll just highlight a few things today, but psychological trauma has certainly affected me. I fit into Sohail's statistic. And just to note, not everyone who goes through something potentially traumatic in fact, experiences the effects of trauma afterward. But for me, yes, it was very destabilizing and dysregulating. I had sleep problems. I still have difficulty hearing particularly loud and unfamiliar noises. While I was trapped in my apartment, there was this anti-aircraft artillery truck parked directly outside of my building. So if you imagine a huge cannon on the back of a truck on a swivel. It was so incredibly loud. It would shake the whole building and it would fire at all hours of the day and night. And so now I'm very sensitive to sound. And maybe kind of one unique or interesting thing is that I rarely wear sandals anymore. I feel this need to, when I leave the house, to wear shoes or boots so that I am ready to run or be prepared for anything, which may or may not be rational, but that's what I feel most comfortable with now. Maybe I'll start wearing sandals again. And I'll end on this because I want to end on a moment of hope. It's not all doom and gloom, I think. For example, you might be familiar with the term PTSD, post-traumatic stress disorder. There's also this really cool term called post-growth, where research says that around half to 2/3 of people who go through something traumatic, they feel a profound sense of growth afterward and maybe even have a more positive outlook on life, a stronger purpose in life, or they really strengthen those relationships in their lives that matter most. And I certainly feel those things. And lastly, speaking of appreciation for relationships, my Sudanese colleagues shaped me greatly in this experience. I am amazed by the resilience, the courage, the graciousness that they have shown. I have such a deep respect for them, and especially those who are still working in Sudan. Sudan fi qalbi daiman wallahi. Sudan is always in my heart. So thank you.
Thank you so much, Ash, for sharing so openly and candidly about your experiences. And first of all, of course, we're grateful that you're here to tell the story. And certainly for me, there was a lot of learning there about purpose. And I love how you ended on the concept of post-traumatic growth, because it can be, often we can delve into just focusing on trauma and vicarious trauma. And so it was really positive that you ended on that point to show that there is a light at the end of the tunnel. Thank you very much. And so for now, I'll move on to our next speaker. Our next speaker is Karen Abbs, who is a global specialist in staff wellbeing and MHPSS with 20+ years of experience across humanitarian and development context. Most recently, Karen has co-created UNICEF's Staff Care in Emergencies Framework, along with interactive tools to strengthen resilience, well-being and access to mental health support in emergencies. So Karen, it's really great to have you here with us. And my question to you today is to really help us in understanding what gaps are there in staff wellbeing support that led to the development of UNICEF's Staff Care in Emergencies Framework, and how really has that paper been moved into practice?
Wonderful. Thank you. Thank you so much, Nana. And it's such a pleasure to be here with all of you today. And Marie's going to be my backup support with sharing my slides. So thank you so much, Marie. And I just first wanted to start with thank you, Sohail and Ash, for everything that you've shared. Sohail, for sharing with us the increasing risk and the increasing impact that we're seeing on staff who are working in emergencies, and Ash, for sharing your very, very powerful story around what staff need when they're working in emergencies and what they're needing perhaps in preparation, but also on the ground, and what is helpful in terms of support both during events and after events. So just really grateful, Ash, for you sharing your story. So what I'm going to be walking you through is what we created at UNICEF in terms of our staff care and emergencies framework, because what we saw was some gaps. And so I'm going to be walking you through how we did that. And I'm going to use some slides just to illustrate, because some of this is about building paper, and we wanted to give you some images to go along with that. So Marie, if you could just move on to the next slide. So what I'm going to walk you through is how we created the framework, what's in it, and most importantly, how did we move this from paper into practice? Because you can have a beautiful framework, but if it sits on a shelf, it's not going to be very helpful. So we've really at UNICEF worked into moving this into practice. And then just some top tips, recommendations for anyone in the space today who would like to begin their own process of how to move this forward. So Marie, if you could just move on to the next, thank you. So the background to UNICEF's framework that we developed really started with a humanitarian review. UNICEF looked at everything that was in place for staff working in emergencies and found there was a bit of a gap in terms of systems and protocols that were specific to emergencies. So of course, UNICEF has a very well-developed staff wellbeing system that was in place already. But it was felt that we needed to make sure that we were systematically supporting staff who are going into an emergency duty station or for locally recruited staff as well. And something Suhail mentioned is incredibly important around equity. That UNICEF wanted to make sure that there was equity of care for all staff working in emergencies, irregardless of your contracting type. So what we did in order to build the framework was we co-created this. So a huge thank you to everyone at UNICEF. You can go back one more slide, Marie. I'm not quite there yet. Perfect. So we really co-created this within UNICEF, working across departments and also with the other UN agencies. So I met with many UN agencies and also international organizations, looking at what were some of the evidence-based tools, what were some of the best practices that were happening in this space. And so what we began to put together was looking at a life cycle approach. So how do we support staff throughout their employment journey when they're working in emergencies? Again, irregardless of contracting type. If you're locally recruited, if you're international staff, how do we support you in the best way possible? We also wanted to make sure that we mapped out people and culture and leadership responsibilities, governance systems. And the biggest key was around integration, so that this wasn't just a standalone document. It was integrated across all departments, all systems at UNICEF, so it would come to life. So Marie, you can go into the next slide now. So this is a real summary of the framework that we created. So of course, there's a governance system and roles and responsibilities that sit alongside of this, but the key parts of the system are really looking at how do we prepare staff for working in emergencies. So it's pre-deployment or pre-employment. So we have created a systematized system, as in the past it was a bit ad hoc. If staff had pre-deployments before they went to emergency duty stations, or for locally recruited staff, were they receiving some training and support around how to work in emergency and to stay healthy and well. So there is now a standardized system in place where staff receive either pre-deployment briefings before they work in emergency, or for locally recruited staff that they're receiving regular and ongoing training and support in order to keep them well and healthy when they're in the emergency. And then what we've also focused on is what happens when you're in the emergency. So on mission support, and again, putting that into a system and a structure. So it's not just ad hoc as and when, sometimes if we feel like it. There is a system of support that happens for staff who are in the emergency space. And then what we felt was one of the most important spaces was around post-deployment, or if you finished working in the emergency. Often you finish emergency work and you go off and you go either back to a home duty station or you transition somewhere else and you just move on. So we felt that this was a really, really key part of the framework, was how we supported staff to either transition into another emergency or transition back to a non-emergency duty station or to a family duty station as well. And then beginning to rotate this whole system depending on the staff journey. So we very much hope that staff can see themselves in this journey and are finding the systems and the structures for support. So the framework document speaks to all of this, but it was incredibly important to put it into practice. So Marie, if you can go on to the next space. So what we did at UNICEF was we built a SharePoint site. And what is on this site is the framework broken down into usable chunks, depending on who you are at UNICEF. So again, this speaks to the integration. So if I'm working in emergency, you click here and it will take you to all the resources and documents and tools that will support you in your emergency work. If you're in leadership or you're supporting your team, there's a click here button. If you're in people and culture, or if you're in safety and security, if you're a peer support volunteer, there's a place that you can click to go and find more information, tools, and resources. And what we've also done, if you go into the next slide, Marie, is we then put all of our training materials into Agora. So we've now prepared in Agora, so it's where we have our e-learning, our online learning, 3 modules of preparing well, staying well, and transitioning well. So the preparing well module will be mandatory for any staff who want to work in emergency. And part of what's in there is a self-assessment tool around, is emergency work right for me? Is this the right space for me? And then tools and resources to make sure you're truly ready to work in that emergency space, whether you're international staff or locally recruited staff. And then staying well is the biggest module that we're actually testing at the moment and developing. We're developing it in conjunction with the MENA region around developing tools and resources that will help staff when they're working in emergency, both for staff and for leadership and managers. And then we conclude with the transitioning well module. So this will be for staff to take when they're transitioning either into other emergency duty stations or non-emergency duty stations. So there's tools and resources, and we're currently sensitizing staff to the existence of all of these tools with the goal of moving it all into practice. So we'll just go on to the final slide. And these are our recommendations to you if you feel that you as an organization would like to develop your own framework. What we did that was successful was we did a full review. We looked at where are the gaps, where do we need to address these? We collaborated and co-created. So this was a work of many, many people at UNICEF, really across people and culture, across safety and security, across leadership, across staff well-being, making sure that we were creating something that would truly be fit for purpose. And then we've tested it. So we did a soft launch in a few emergency duty stations, and we have now done a global rollout alongside having focus groups and making sure that we're getting feedback. And so it is a constant evolving, living framework that we are really pushing forward in order to support our staff in the best way possible. So with that, I believe I'm at time. So I will thank you to everyone for giving me the space to talk about this piece of work today. And Nena, handing back over to you.
Thank you so much, Karen, for outlining UNICEF's comprehensive staff care framework. And I'm sure there's a lot of that we can learn from that. I love the consistency of it, the comprehensive nature of it, and the amount of resources that are available during the life cycle of employees. And I'm sure that will be encouraging for a lot of people here who are listening in. I have so many follow-up questions that I could ask, but we're at the time now where we open up the discussion to the audience. And we see in the chat that there's a number of questions there that speak to the themes that have emerged in your discussion so far. So Lucia, over to you to facilitate the first question.
Thank you. I'll just go in order of receiving. So this question would be for Sohail. If Sohail, could you please clarify how to have a chance for training of the local mental health worker? Is that through DSS?
Yes, that's through DSS. It's, sorry, please go on.
No, please, you go.
Okay, yes, that certification program, it was initially launched in 2006 and went on till 2018, before the pandemic, and we trained about 300 mental health professionals. So those are psychiatrists and psychologists working in their host countries. And then during the pandemic, we had to redesign the program to make it a hybrid program now. So now with the help of a grant from Japan, we are relaunching the certification program initially for the Middle East region, and then for the West Africa region, and then for other regions. But it's through DSS, and it's a specialized program for psychiatrists and clinical psychologists working in a member state. Thank you.
Thank you. I think related to this, I also want to acknowledge Naima's message, and she says, training of external mental health professionals is an excellent work of CISMs. In the past, they have trained a number of external mental health professionals from a number of countries, and this is a very useful source for some countries. Thanks for your comment. Line Anderson has two questions, and with a short introduction. Their team is running a network for uniformed women peacekeepers, which is a pilot right now. Taking care of mental health and well-being in peacekeeping has come up a lot. So here are the two questions. The first one, have you seen particular mental health and well-being challenges facing female staff? So is there a gender angle to that? And the second one, what is your experience with, for example, peer support structures as a way to help on mental health? For example, now resources are dwindling vis-a-vis enough professional help.
So you would like me to take that, Lucia, or somebody else?
You can kick us off for sure.
Okay.
Please.
In terms of the differences in on gender, between male staff members and female staff members, yes, there are differences. There are qualitative differences between their lived experience of psychological trauma, and there are quantitative differences as well. Globally, even outside the humanitarian sector, the prevalence of post-traumatic stress, burnout, and other common mental health problems is higher among females as compared to males. And that proportion is seen in humanitarian workers as well. And also the peculiar qualitative challenges of being a female peacekeeper or a female humanitarian worker, like Ash was describing, they are also different to some extent from what a male humanitarian worker would go through. It's not a comparison, but there is a difference in the lived experience. And generally, it is higher among female humanitarian workers. The second question was about peer support networks. Yes, there have been multiple versions of this in the UN Secretariat, as well as in the different agencies, funds and programs. They are quite successful, especially in emergencies, where they are mobilized, they are trained, they're able to provide psychological first aid to their colleagues who need help. What we have seen as a lesson learned over the years is that they need to be closely supervised and coordinated and guided so that the first requirement of do no harm is taken care of. So peer support volunteers, training them is one element, but the supervision, coordination, and their guidance while they're carrying out their activities, that ensures that their interventions are actually helpful for people and there is no risk of harm. That would be the key lesson learned that we have observed over the years. It's a good model. It's based on the WHO model of community mental health workers, a very well-established model of psychological first aid, but with close supervision, coordination, and guidance. Thank you.
Thank you, Sohail. And I saw Ash nodding. You want to come in?
Sure. I'd love to come in on both of those points. With the peer support structures, one of the things that can be really successful, especially in emergency settings, are support networks. In WFP, we evolved, we changed the peer support model to a wellness support volunteer. As Sohail said, we did not want to send the message that these peer support volunteers had the same level of qualifications as a counselor. We're all licensed and registered with master's degrees in mental health counseling. And we also didn't want to put that responsibility onto a peer to feel like they have to take care of people's problems. So we tried to make the focus more on knowing how to refer people to the counselor. How do you encourage, and what kind of language might you use to refer people to a counselor? And we also, there was a big emphasis on being a positive presence in the office, but doing group and community well-being events. So it really was less about peers supporting peers one-to-one and more about creating a sense of community and normalizing wellness within their offices. And so Hale said they need close supervision. Yes, agree. I think what made our wellness support volunteer network successful within Sudan was that I met with these wellness, I vetted them. They had to go through a pretty rigorous training, and not just me vetting them, we vetted. And we met every month. There was a commitment to deliver upon, I think it was 2 well-being events throughout the year. So it did take a lot of effort on my part, but it was completely worth the reward. I still talk to these wellness support volunteers. They are still doing beautiful work in Sudan during the war. So I think I echo Sohail that they can be successful, but need to be carefully crafted, carefully supervised. And regarding your question, I worked, the first question, I've worked in with women peacekeepers, and I remember one of the biggest mental health challenges. I was in an duty station, and I thought that the mortars were going to be the problem there, but actually it was more about sexual harassment that was the problem. And I remember being quite shy to speak up about this. Sometimes it's a bit of a taboo subject, but it was happening quite a bit, and not just to women, but also to some men. But that was very much a mental health and well-being challenge. So one thing that we decided to do was to start having regular women's group meetings. And sometimes we would feature and highlight a woman in that duty station, and trying to be really strategic, picking a peacekeeper, a national employee, an international woman, like really trying to highlight the diversity. And so again, that was a network and community. So I really encourage those of you in these difficult duty stations, emergency duty stations, create communities, and staff counselors can help with that.
Thank you, Ash. Thank you so much. So we have another couple of questions for Sohail, but I'm also aware that we might run out of time. So I'll just read it quickly, and then Sohail perhaps will send you all the information, and you can follow up with the colleagues who asked the question. From Elvira. Hello, thank you, Muhammad Ali, for sharing your experience. We recently connected with a local therapist in Ukraine, but it wasn't easy to find them. Would it be possible to create a list of locally trained counselors that we could share with this community? Thank you so much. And then the questions I wanted to read for Karen. of compliments. This looks great. Could you please share the framework and PowerPoint? And then some specific questions on pre and post-deployment briefings are mandatory and only for international staff. How is the procedure managed with HR, and who does the brief happens if red flags are noticed?
Thank you. Thank you so much, Lucia. Thank you, Elizabeth, for the questions. Really great questions. In terms of sharing the full framework, I just need to check with UNICEF how widely we're going to be sharing it at this point, just because we're testing it at the moment. But I believe the intention is once we've tested it and done revisions, that will be open for sharing. And thank you for asking the question about, is this just for international staff? And I know sometimes the language of pre and post deployment implies international staff. And we wanted to make sure there was equity. So for international staff, yes, there's mandatory pre and post deployment briefings now. These are done by our staff counselors. And if there's any red flags, then the staff counselor can continue to follow them. So they are held then in the care of the staff counselor. For locally recruited staff, how we were managing this is I'll use Ukraine for an example. So we do regular trainings and briefings for staff in Ukraine on how to stay well, strategies for well-being when working in emergencies. And we'll offer those at regular intervals. And then when staff are brought on as new staff, once a month, we'll do briefings for new staff coming on board as well. So we're capturing both international staff and locally recruited staff. So they're all receiving the same types of information. For the pre and the post, sometimes those are done in groups as well. If it's a large-scale onset emergency, we will sometimes do the pre-deployment briefings as group briefings as well. And the goal of it is really to connect them in with the staff counselor. So if there are red flags, if there are any challenges, the person feels much more comfortable approaching the staff counselor. And we're hoping this helps to destigmatize as well, reaching out for support in emergencies. Then the logistics of how we manage that, this is a great question. We are actually working with our IT department to set up a system because UNICEF has quite a few surge mechanisms. There's some people come into surge and into working in emergencies from multiple different pathways. So we're working with people in culture as well as our IT department, how to set up a system to seamlessly capture this, to make sure that we're seeing everyone who needs to be seen. But back over to you, Lucia. Thank you for the questions.
Karen, thank you. And you were very brief. And I understand there's a lot of interest on what you're doing. So I hope we'll have additional time in different platforms and occasion to go through the details. I also wanted to read. Sorry, I lost the Q&A. Give me 1 second. Yes, a comment from Hamad. Yes, the humanitarian workers were targeted in Gaza directly at UNRWA. More than 270 staff were killed. Staff were exposed to famine, and they were not able to secure food. How we should support humanitarian workers in Gaza? That's not an easy question, and I leave it to Nana and our panel to address this.
Sure. I guess, yeah, I'm just also conscious of time, but in regards to the question, perhaps each of you could, or one of you could just provide a snapshot, 1-sentence reply to that. I know that may not be sufficient to answer a question that is multi-layered, but over to you. And then after that, I have one more question before we wrap up. Sohail, I see you edging towards the camera, so please go ahead.
Yes, can you hear me?
Yes, we can. Over.
Yes, what that colleague has mentioned is very true. It's very true. Our colleagues, humanitarian workers in Gaza, have gone through a lot. They've gone through what many humanitarian workers had never imagined. And it has also happened in Sudan, in Ukraine, in some other emergencies as well, but not to the extent as it has happened in Gaza. In terms of support, there is if you look at what Ash was mentioning also, there is a hierarchy of what people need in an emergency. So first, they need to be safe. They need to be in a safe location. They need for themselves to be safe. Then they need basic necessities, like what Ash was mentioning: food, water, shelter, healthcare. And once that is secured, then in addition to that, psychosocial support, well-being services, and ability to make, or the opportunity to make meaning of what has happened. So there is a layered system of support where initially the important thing is to make people safe, protect life and limb. After that, protect the basic needs of staff members, like what the colleague was mentioning about famine. After that, provide them the opportunity to be together as a family so that their loved ones are also protected, and to take care of the medical needs. And in addition to that, then to take care of the psychosocial support needs. So that's the ladder that we've climbed in terms of supporting humanitarian workers and their families. I could go into more detail, but that would be beyond the scope of this webinar. Thank you.
Thank you so much, Sohail. A difficult question to answer in a condensed amount of time. I'm just looking, we have 5 minutes left before we round up, but we also really wanted just to touch upon the idea of how do you support yourselves? Because we've talked a lot quite about the importance of what makes an effective staff care framework and the resources that need to be involved and how heavy it can be on the person. So very quickly, would you be able to share in 1 minute, each of you, what effective support you would, or a nugget of advice you would offer to people on how to look after themselves, particularly those colleagues like yourself that are on the front line who were there providing support in the context of emergencies and crises? Over. Thank you.
Well, maybe Ash and Karen can go first.
Sure.
I had one follow-up point on the previous question about supporting those in Gaza. I think it's so important also to ask them. They were there, they were the experts of their experience. What might they need? Sometimes we make assumptions about what somebody needs, and it's so important to hear from those people and understand what they need. And then my nugget is, I mean, I'm a therapist, so therapy. You know, it's not the only way to get through these things. A lot of research supports reconnecting with yourself and reconnecting with other people as a means to heal trauma. Therapy can be a really effective way, and I believe in it. I am a therapist. I certainly sought therapy after everything in Sudan. So I would encourage people to seek out counseling, therapy, or some kind of support, supportive friends, a supportive community, supportive loved ones. That would be my nugget for caring for self.
Thank you so much, Ash. And I see you nodding, Karen, in agreement. Do you have anything else to add to that before I wrap up?
Absolutely. And what I would add to that, and it's something we built actually into the framework at UNICEF, is around self-awareness and how do you stay in tune with self? Because, you know, from working in emergencies myself, I know how quickly you can slip into burnout, and it happens so fast. And so we really, for myself, I know my early warning signs for I'm getting into a pretty bad place with stress, and I need to take a step back and really focus on some micro resilience. How do I look after myself on a day-to-day basis? So self-awareness and paying attention to those early warning signs that it's time to take a pause is what I find most helpful.
Thank you so much. And Sohail, I see you nodding. Can I take that as an agreement?
Yes, well, I
Is
can
there
mention
anything
one
else you'd
more
like
point.
to answer?
Yes, it's one point. It's what keeps me going is the feeling of having some meaning to our work. If there is meaning to what we are doing, if we are able to impact some people, even a few people, to help them positively, that sense of purpose and meaning, it can keep me going even at the darkest of times. So that's what helps. Besides what Ash and Karen have mentioned, I fully agree with that. In addition to that, it's that sense of meaning or purpose that what we are doing is helping somebody, maybe a few people, but it's helping somebody somewhere. Thank you.
Thank you so much, Suhail. We are also out of time, but I really want to thank you very much for all of you on the panel today for really illuminating this space and understanding the amount of effort that it takes to coordinate support and in the context of catastrophes and emergencies. And I think just, really to conclude, what it's really shown is that awareness and accessibility is important. We definitely need ample resources to be able to ensure that a timely response is provided. And one of the things that really spoke to me was the importance of coordination and collaboration. So once again, thank you very much for each of you for sharing very openly about your relevant perspectives. And also thank you very much for the ongoing work that you're doing with your teams, both at CISMS, UNICEF and WFP. I thank you all for the participants for engaging in the conversation today, but also my own global mental health team for all the work that's gone into putting this event together. Just a quick reminder that we do have 2 more World Mental Health Day events tomorrow. Thursday the 16th, there's a Nurturing Neurodiversity in the Workplace event that's taking place. And then we also have the Echoes of Silence, focusing on family-centered mental health support, again, in the context of humanitarian emergencies. So that will be available in English and also the following week, the 23rd, in French. So thank you very much, colleagues, for your interventions and perspectives, and see you again soon. Bye-bye.
Thank you. Thank you so much.
Thank you, everyone.
Thanks, everyone.